I'm a Bloomberg Fellow.
I am a Bloomberg Fellow.
I'm a Bloomberg Fellow.
And I'm a Bloomberg Fellow.
I'm a Bloomberg Fellow.
And I'm a Bloomberg Fellow.
I'm a case manager for people living with hepatitis C.
Director of Suicide Prevention.
Historian and preservationist.
Detective with the Threat Response Unit.
An attending physician in the emergency department.
I work at the White House Office of National Drug Control Policy.
Bronx Connect.
Fort Lauderdale Police Department.
Get Healthy Philly.
The Hawaii Department of Health.
Food and Water Action.
I became a fellow to make sure addiction is seen as a disease.
I hope to do my part in ending youth homelessness.
I became a fellow to find new ways to address the effects of vacancy and abandonment.
I hope to reshape the food system to promote community and ecological health.
I became a fellow to strengthen primary prevention of human trafficking.
I hope to collaborate toward solutions that are bigger and smarter than what we are up against.
To promote social justice for people who use drugs in marginalized communities.
To promote mental health and decrease risk among minority youth.
To help reduce our nation's gun violence crisis.
To attack the true root causes of unhealthy environments.
Join us.
Join us
as we work to save lives.
And build a healthier future for our country.
And build a healthier future for our country.
Thank you all so very much for joining us. Every time I see that video, Faria, I get excited about the fellows that are currently a part of the work. And for you all, that can be you. So thank you for coming on to learn more. This is the Bloomberg American Health Initiative Bloomberg Fellows webinar series. Today, we'll be talking about the addiction and overdose focus area. My name is Shane Bryan. I'm the Partnership and Engagement Officer here with the initiative. And joining me in studio today is my colleague, Faria Zaman, the Fellowship Officer.
Thanks, Shane. Good afternoon, everybody. Great to be here with you, Shane.
Absolutely. And joining us on the line as well is Thaddeus Pham, the Bloomberg Fellow and Viral Hepatitis Prevention Coordinator for the Hawaii Department of Health, and Sean Allen, Assistant Scientist here at the Johns Hopkins University Bloomberg School of Public Health. To give you a sense of what we'll be talking about today, we'll go into a little bit of the history on the initiative, talk about our 5 focus areas, cross-cutting themes, the approaches to our work, and of course, talk about the Bloomberg Fellows program and the addiction and overdose focus area. So let's go back and talk a little bit more about how the initiative was launched. Back in 2016, that was when the school was celebrating its centennial here in Baltimore. And Bloomberg Philanthropies and the thought leaders here at the school were trying to think through how we can change the trajectory of health in the United States, as we had seen 2 straight years of life expectancy decline. So they came up with 5 critical areas for us to focus our energies in, which we now call the 5 focus areas. Those areas are addiction and overdose, adolescent health, obesity in the food system, environmental challenges, and violence. We take a very broad approach when we're thinking of these 5 areas. So violence as an example. Certainly we're looking at gun violence, intimate partner violence, but also structural violence and how community-based violence is affecting the health of the individuals of that particular community. For environment, it's air quality and climate change, but also how a built environment in a community affects the health of those individuals. So today we're going to talk about more of the addiction and overdose focus area, hear from a couple of the folks who are very involved in either their work at their respective organization or their work here at the school. So we have the 5 focus areas. We also have our 3 cross-cutting themes. And these themes cut across all of the work that we do here at the initiative: equity, evidence, and policy. Now, equity is about the lived experiences of the individuals who are involved, and as a national initiative, ensuring that we're active in all communities across the country and U.S. territories, urban, rural, and suburban. For evidence, it's all about the data, ensuring that we're collecting and gathering high quality data to inform our practices, our policies, and make sure the decision makers are using that data to make enhancements to their programs. For policies, it's national, state, and local level policies, and also organizational policies, because we know that the policies at your organizations greatly affect the way that you work with and interact with community. All right, Faria, so we've talked about the 5 focus areas, our 3 cross-cutting themes. Now we should talk about the approaches to our work. So here at the initiative, we do research, practice, and education. For research, we're talking about funding and supporting faculty here at the School of Public Health to work with and collaborate in communities all across the country. Now, for us, it's not necessarily about writing more research papers or getting published. Rather, it's about how we can use these resources to make an impact in a shorter term. All of our grants are 1 year or less, and faculty are able to create products, toolkits, programs, and policies that's transferable from one community to the next. For practice, it's supporting faculty here at the school. We have endowed 25 faculty positions, 5 across each of the focus areas, that will support emerging leaders in their field, individuals who are taking innovative approaches to their work. And we're excited about this because these are the faculty who are supporting our fellows, collaborating with the organizations, and really thinking outside the box of ways to address the particular focus areas of the initiative. All right, so we've gotten research, practice, and that leaves us with education, Faria. So that's our Bloomberg Fellows program. So do you want to talk a little bit more about the Bloomberg Fellows program for our listeners? Because I think that's why folks are here today.
Absolutely, Shane. So I'm really excited to tell you all about the Bloomberg Fellows program. So this is a very unique type of scholarship program. It is impact-based, and it targets those individuals who are already working on the front lines of any of the 5 focus areas. Fellows center their studies in their particular focus area. They engage with their organizations, and once they complete the MPH degree, fellows do what we call a service obligation, and that means working with their organization for at least a year following graduation, and their organizations join this amazing network of practice and research with the Bloomberg School. And I also want to add that all organizations are eligible, whether it's a governmental, non-governmental, a hospital, a school system, a small community-based group. Everyone is eligible as long as the organization is based here in the U.S. and they are working in at least one of the 5 focus areas. And Shane, I thought maybe you would like to elaborate on the network of practice.
Absolutely. So we're building out this national network of practice of individuals and organizations all across the country who are working in these 5 focus areas. This is bringing together the organizations to connect and collaborate with each other, but also connecting with faculty here at the school, looking at some of the critical issues of their communities. And it's a great opportunity for the traditional and non-traditional organizations to work on innovative projects. So all of the fellows and all of the organizations who become a part of the Bloomberg Fellows program are also a part of this network and joining in to really start impacting and improving the health of their communities. Another really exciting opportunity through this network is our annual Bloomberg American Health Summit. This is a 2-day impactful opportunity for everyone to come together. We have our fellows, our organizations, faculty, and thought leaders from across the country. We're diving deeper into these areas and thinking about how we can make progress in the years ahead. So we have talked a lot about what it is for the Bloomberg American Health Initiative and our Bloomberg Fellows program. We want to make sure that you know if you have questions that you can email us and we'll be able to address them at the end of the session. So here's a good time and just opportunity to say email us at bloombergfellowsmph@jhu.edu, and we'll do our best to answer your questions as we go throughout the presentation and at the end. So again, bloombergfellowsmph@jhu.edu for your questions. A really common question that we get, Faria, is folks want to hear more about what the difference is between the part-time or the full-time option as they're considering applying. So it might be a good opportunity to talk more about that.
Absolutely. That is a great question. So the Bloomberg Fellows program accepts those applicants who are interested in pursuing the MPH degree, either full-time or part-time. Now, if you're full-time, you are based here in the Baltimore campus for 11 months. beginning in June and ending the following May. So it's very intensive and very quick. And for our part-timers, the degree is available almost entirely online. You can take the courses from anywhere in the country. Typically, part-timers take 1 to 3 courses per term, and we have 5 8-week terms during the course of the year. And it takes roughly 2 to 3 years typically to do the program on a part-time basis, and you have a max of 4 years to complete the degree. So it's very flexible.
It is. And I think as individuals are considering applying for the MPH program and the Bloomberg Fellows program, is to have that conversation with your employer and ensure that you pick what is the best fit for you, the employer, your family, and the various commitments you might have. We have lots of fellows who are doing the part-time program, allowing for them to continue working full-time and being with their families and other requirements that they might have in their respective communities. So we have some amazing courses here at the school, and I know that Thaddeus, you'll hear from in just a moment, can tell you a little bit about those, but do you want to highlight some of the courses as well?
Yes, I do. So I just want to share a sample of courses that are available in the addiction and overdose focus area. And as you can see, we have some really interesting and innovative courses ranging from the opioid crisis to harm reduction to health communication programs. And like I said, this is just a small sample. And students have electives, Shane. And so you can choose from many different electives, the courses that you really would like to take. And now I'd like to introduce our amazing Bloomberg Fellow, Thaddeus Pham from Hawaii Health Department. Hi, Thaddeus. Thank you so much for being here.
Hi, Faria. Great to be here.
Good. Great to have you. So, Thaddeus, I thought it would be interesting if you could tell us a little bit about your work with the health department in Hawaii.
Sure. Yeah. So I'm the viral hepatitis prevention coordinator, and I work in the harm reduction services branch. So really what we do is we use infectious disease as a jumping off point to address larger social justice issues. So it's very exciting work. We're always looking intersectionally and really seeing how hepatitis relates to other issues like housing and mental health and migrant healthcare, pretty much everything. So, yeah.
Wow, that's terrific, Thaddeus. You are one of our part-time fellows, and I think it would be helpful for our audience to know, how do you balance working full-time and taking your MPH course load? Can you tell us a little bit about that, please?
Yeah, I think it's been a really great experience because the part-time program has allowed for a lot more flexibility. And I think that's something that I've kind of learned in the short time since I've started is just to be really intentional about my time. So there's time when I'm doing work and there's time when I'm doing school. And then there's also time when I'm not doing either one of those. And I really just make sure that when I'm focused on one of those things, then that's what I'm doing. So it's been really helpful.
Okay, that's great to hear that it's been so flexible for your needs. Thaddeus, you have been taking courses for a while now, and I wonder if you've been able to apply any of the skills and knowledge that you've been learning in your coursework to your actual job.
Yeah, actually, it's been really helpful. I've been doing public health for about 10 years, but I've never was formally trained. So the school has provided me kind of a great way to conceptualize the work, and it's given me the language and skills to really enhance the work that we're doing in Hawaii. I'll also add that I started my practicum project, so that has really, allowed me to get in there and to really work more directly with our community agencies and our community partners. And I've learned so much just by taking that time to sit with folks and to talk with folks and to really see what service provision is like in our different agencies.
Oh, that's fantastic. It's great to hear you've already started your practicum. Good for you, Thaddeus. Thank you so much.
Yeah.
Thank you, Thaddeus.
Thank you.
It's always really exciting to hear from fellows and to hear about the great work that they're doing. And every time we get a chance to hear from them, I feel like it just makes us more excited to meet all of you who are interested in also applying and becoming a part of this movement. Next, I want to introduce Sean Allen, who is from the School of Public Health here. Thank you so much for joining us, Sean.
Yeah, thanks for having me.
So if we could just start off by you telling us a little bit more about the work that you do here at the School of Public Health.
Yeah, definitely. So as a faculty member, most of my work examines the underlying drivers of overdose and infectious disease risk, specifically among people who use injectable drugs. I also do a great deal of work in the policy realm, and that work ranges from evaluating the public health effects of policy changes on overdose and infectious diseases among people who inject drugs, to really working with jurisdictions to develop evidence-based drug policies. I also co-teach a seminar. It's called the Opioid Crisis Problem-Solving Seminar, and we focus on the opioid crisis and developing evidence-based response strategies.
Wonderful. And I know some of the work that you have been doing has been supported through the initiative. And so can you tell us a little bit about some of those innovative projects that you've been a part of?
Yeah, so we recently completed the West Virginia Count study, and that study aims to quantify the size and characteristics of the population of people who inject drugs in Cabell County, West Virginia. Cabell County is a predominantly rural county in Appalachia, and it's been disproportionately affected by the opioid crisis, and it even leads the state of West Virginia in heroin-related overdose fatalities. We set out to do this because very few rural communities have up-to-date prevalence estimates of injection drug use. And without those data, it's really difficult to develop policies and programs that are responsive to community-level needs and really think through strategic resource allocation for things like naloxone and harm reduction services. So through this study, we administered about 800 surveys among people who use drugs. We were able to estimate that about 2.4% of the population of Cabell County had recently injected drugs. We also published our findings in a number of journals, and the topics range from factors associated with naloxone possession to correlates of transactional sex, as well as polysubstance use. And then as a final component of this study, we also developed a methodological toolkit. And we did that because we expected that other communities, they would want to implement their own studies. We wanted to give them a roadmap on how to do that.
That's wonderful. And that goes back to what we talked about earlier in ensuring that the research through the initiative is transferable and other communities will be able to benefit through the knowledge that's gained in these projects. So I know folks can actually go online, the Bloomberg American Health Initiative website, and learn more about that particular project that Sean has just shared with us and see that toolkit. And so please go online and check that out. But another question, Sean, I would love for you to just talk a little bit more about the importance of the initiative in our focus in addiction and overdose as we're looking to improve the health of communities across the country.
Yeah, so since 1999, more than 700,000 overdose fatalities have occurred. All of them were preventable. Committing an area of the initiative to addiction and overdose is really important because there's never been a more critical time for the translation of research to policy and practice. In my opinion, we can end this crisis, but we have to have public health at the decision-making table, working with policymakers, and really having an evidence-based crisis response strategy.
Yeah, I mean, it's great, Faria, to hear the work that Sean's doing and the things that Thaddeus has been involved with. I mean, it is preventable.
It totally is.
Yeah, and there's more work, and we know that you all who are joining us are on the front lines doing this work, and we thank you, and we want you to be a part of this initiative, and we're excited that you are learning more right now. So I think that you probably are ready for us, and maybe Farah, you can talk a little bit more about how they can apply.
Yes. Let me talk about how to apply to the fellowship. So applicants should apply to both the fellowship and the MPH program at the same time. So you should have a look at the MPH website, and they give very explicit instructions on how to submit all of your admissions materials and exactly what the admissions requirements are. So you want to do that first. And all of your materials would be submitted through SOPHIS. And SOPHIS is the name of the Bloomberg School's application processing system. So all of your admissions materials, your transcripts, your essay, etc., everything is submitted through SOPHIS. And at the same time, you will apply to the fellowship. We have 2 fellowship application forms. One is the applicant form and the other is the organization form. And those will be found right on our website where you download them, you complete the forms, and you also submit them on our website. So all of this has to be done jointly, and the final deadline for the fellowship will be December 1st.
Wonderful. So now that you know how you can apply, we want for you to see one of our fellows in action. Enjoy this video.
Emergency services overwhelmed. Another family burying a loved one.
91 Americans are still dying every single day.
Drug overdoses now kill more people than guns or car accidents.
This opiate crisis, we've seen so much loss and so much grief. There's people that are struggling with a major health issue that are being pushed aside. It's so important to provide that safety net for those folks so that they don't have to feel alone, so that they can still have a chance to rebound from that situation. The Bloomberg American Health Initiative's goal is to really build tools to help address these issues in communities across the country, to be able to bridge that gap between the voices of the people using on the street and the people trying to figure out what to do to address this epidemic. I think about drug users' health as an entire continuum of care that people need to survive. It starts with making sure that they have the tools and the knowledge to be safe while they're using. It's so beautiful to be able to help build up a community of people who can take care of each other. You break down those walls and those barriers just enough, and then people make changes in their lives.
That is such an excellent video. And by the way, I want to say that Haven is part of our inaugural cohort of fellows, and she's doing really amazing work in Portland, Oregon.
Yeah, it's really, you can see the passion that she has in her work. And, we know that Thaddeus is very passionate and does similar things in Hawaii. And these are the people just like yourselves who are tuning in, using the lens of public health to address your work and deepen the impact that you're making is critical to ensuring that we're improving the lives and healths of the folks that we're working with. So we got some really great questions from you all. We're looking forward to doing our best to answer many of them. We just want to let you know that we will continue answering questions offline. We'll be responding to your emails. And if you get any other questions, please feel free to email us, bloombergfellowsmph@jhu.edu, and we'll continue responding to all those questions. So, Fari, I'm going to start off with a question that we've gotten in. It's a common question that is proposed is, this individual's been out of school for a number of years, and they are a little concerned about applying into a graduate program and starting to take classes again. So do you want to talk on that?
That's a great question, Shane. So, first of all, I want everyone to know that most of our applicants have been out of school for a long time, 10 years, even 15 years. And so please don't be discouraged at all. What you should do is start the application process early on. The MPH program, they require, some prerequisites and the GRE. And so I always tell people to speak to the MPH program, find out what you need to do, and prepare and take your GRE way in advance so that you have time to prepare. A lot of people haven't taken it in a while, and so you need time to prepare, actually take the exam, and let that score reach SOPHIS. So the earlier you start planning, the better.
Absolutely, absolutely. And a question for Sean. I think this one would be good for you to answer and chime in. We had a participant email in and want to hear more about the ways in which students can be involved with faculty, either connecting on research projects or just in general, the access that students have to faculty here at the school. Can you talk a little bit more about that?
Yeah, students have many opportunities to work with faculty. Almost all of my research and policy work relates to harm reduction and drug policy. And on all of those projects, I try to involve students at every opportunity possible. So I've had students involved in data collection as well as leading manuscript submissions. And if students are interested in drug policy or harm reduction, any of those topics, please reach out. I'm happy to discuss potential collaborations or future studies. I love mentoring students, so please do not hesitate to reach out.
That's great to hear, because that's a common question we get. Students, applicants want to know how they can be involved with faculty. So that's great to hear. I have another question here, which I think would be great for you, Thaddeus. A lot of applicants ask about how supportive is the fellowship program to those people who haven't been in school for a long time, have been out of school for 10 years or longer. Can you talk a little bit about that, Thaddeus, of your experience of being in the program and the kind of support that you receive?
Sure. Yeah. So I'll start with the fact that I hadn't been in school for about 15 years, as you had mentioned. So it was a transition, but it was actually a really great transition. So, well, first of all, I got great support from you folks at the Bloomberg Health Initiative. The staff are so welcoming and so supportive and very responsive to everything that we ask about. And then the faculty have just been welcoming whenever I've reached out to folks as well. So I really valued that. I know some of my colleagues have already availed themselves of the tutors that are available and all the other resources, whether they're on campus or doing part-time online like myself. And I found something that was amazing was just connecting with the cohort of other fellows has been so inspiring, and also it's like building kind of a whole new family of public health folks. So we have our local folks here in Hawaii, but just to know that I could reach out to other folks in other states across the nation for support, whether it be just asking what the homework was last night, or to really think about policy level interventions that they've done in their state. So I think just acknowledging that there's this great network of support at so many different levels, and that's been very helpful.
Oh, that is so fantastic to hear, Thaddeus. Really, it is. Thank you.
Yeah, thank you for sharing that, Thaddeus. And I will also say that one of the ways that we want to support students and organizations is ensuring that that network and that fabric is being created where people are collaborating, working together, and sharing best practices. So it sounds like it's working, and we're really happy to hear that, and looking forward to many more ways in which folks continue to connect. Another good one, I think, Faria, for you, I know you mentioned this briefly earlier when we're talking about the organizations who are applying with the fellows. Are there any type of restrictions at all when it comes to the organizations who are applying?
Okay, well, that's a good question. So definitely no, there are no restrictions in terms of, what kind of organizations are eligible. And as I mentioned, we have organizations ranging from federal agencies to small community-based health organizations in rural parts of the country. We have school systems. We even have libraries, and we have academic institutions. So there are no restrictions. As I mentioned, the organization should be based here in the U.S., working in at least one of the 5 focus areas, and that is the basic eligibility. So really, all are welcome, for sure. And speaking of organizations, Shane, I wonder, do you want to talk a little bit about how organizations are engaged with the initiative?
Yes, absolutely. So there are a number of ways that we seek to work with and partner and support the organizations who are part of this initiative. A really key component of the Bloomberg American Health Initiative and the Bloomberg Fellows program is that it's not just a scholarship. It's not just a student gaining their education, but really it's how these organizations, the employers, if you will, are involved in supporting the students, but also working with faculty, connecting with one another. So we talked earlier about the National Network of Practice, and through that, there are ways to support organizations connecting, quite literally, in other communities with folks who are doing similar work, to learn from the lessons that they have gone through and how they can take those lessons back home into their own communities. It's also connecting with faculty here at the school, either collaborating on research or working with consultations through various issues that they may have in their home communities. So there's a number of ways. We don't have requirements either for how an organization engages. Rather, we want to ensure that we're meeting them where they are. Some folks have a greater capacity for more opportunities, and we want to make sure that they're getting the most out of it. It's all about mutually beneficial opportunities. And so it's not just the student getting the education or the organization connecting with faculty, but ensuring that all are benefiting from being involved in this particular initiative and network. So great question. And I think another thing, Faria, we often get questions about how do I convince my employer that this is a good fit for them? And I think we have some really great resources online, a frequently asked questions section. I think they can go there.
Yes, they can certainly go there. We have the frequently asked questions specifically for the collaborating organization, so they could go there. And also, please reach out to us, because we are happy to speak with you, to speak with your organization, to answer their questions and give them as much information that they need. So don't hesitate to reach out.
Yeah, definitely. So another really great question, Faria, is what does an ideal applicant look like?
So that's a great question. And so we are looking for those individuals who have a track record working in their particular focus area, who have a demonstrated commitment to continuing working in that particular area and being a change agent in their community. And we're looking for an organization that is highly supportive of that applicant as well. You know, when we review applications, we look at everything an applicant submits for the MPH program and the fellowship application forms, but the greatest weight is placed on what you and your organization tell us in your application form. So don't be modest. Tell us what you've been doing. Tell us about your accomplishments, and we want to hear the same from your organization as well.
Yeah, and I think a really important piece of what Faria just shared, folks, is ensuring that your organization also takes interest in this. It can't just be there filling out a form to be your supporting organization. It really is considered through the decision-making process. Those forms are important for the folks who are making those decisions. So I think another question, and where I think we're getting close on time, I see them giving us the signal, but maybe we could do this last one, Faria. What if an applicant doesn't get into the MPH program?
Okay, well, that's a good question too. So if an applicant doesn't get into the MPH program, do not be discouraged. Try it again. We have had applicants in the past years where at first they weren't admitted to the MPH program, and they tried again and they got in. And what I tell people who don't get the admission the first time around, talk to the MPH program. There are wonderful staff there who will talk to you about how you can strengthen your application and really give you specific guidance on what you could do to improve to apply. So you should speak with them, and you should not let that discourage you at all.
Yeah, great. So we have ran out of time for questions, but we thank you all for continuing to ask really great questions. And Faria and I will go online and respond to every single question that we get in. So continue sending us your questions at Bloomberg Fellows, mph@jhu.edu. But there's other opportunities to stay engaged. So we have a weekly newsletter. It's called the American Health Dispatch. And we want to make sure that you go on our website, you subscribe to the newsletter. It comes out every Friday with wonderful resources, news articles, and just updates on what's happening here at the initiative. While you're at our website, as I mentioned earlier, Sean's information on the work that he's done is there, along with many other research projects, toolkits, programs, and policies that we've been involved in over the last few years that the initiative has been around. There's great resources that you might find useful in your work today. So go ahead, go online, do some exploring, and find some of those opportunities there. Our YouTube page is full of wonderful videos. We're actually going to put this recording on our YouTube page as well, but you can go there and see some of the seminars that we've held on campus, the summits that we've held in the past, the thought leaders who are doing amazing work all across the country. It could be resources that you use in your work or trainings that you might host, but go there and please look around and see what might be of interest to you. And finally, we're of course on Twitter. Follow us at American Health. We'll be sure to follow you back.
Yes, and one more thing, Shane. I just want to let everyone know that the next call for fellowship applications will be announced in early August on our website. So please keep an eye out for that announcement the first week of August, and we are excited to get your applications. Thanks, everybody.
Thank you so much. Have a great day.